Hi, I am Morris. She's Annie.
Hi, I'm Annie.
We'll be hosting this channel together. Let's start today's content.
Do you think myocardial infarction is a disease only for the elderly? Let me introduce you to a handful of misconceptions about myocardial infarction that can lead to serious health implications if not corrected. Stay tuned as we debunk these common myths about myocardial infarction. First off, many believe that myocardial infarction is a disease of the elderly. But let's bust this myth right now. Myocardial infarction doesn't exclusively target senior citizens. Over the past few years, we've seen an uptick in the incidence of this condition, and guess what? Young and middle-aged folks are becoming part of the high-risk groups too. It's a clear reminder that heart health matters at every age. So, age isn't the only risk factor for myocardial infarction. Another misconception is that the only symptom of myocardial infarction is chest pain. But the truth is, symptoms of this condition extend beyond mere chest discomfort. It can also include shortness of breath, a sudden cold sweat, nausea, vomiting, dizziness, and a general sense of weakness. These are all indicators of a possible myocardial infarction and should not be ignored. Now onto the third misconception, the belief that gobbling down painkillers can alleviate the symptoms of a myocardial infarction. While they may offer temporary relief, they certainly don't address the root problem. Painkillers can mask the severity of the situation, delaying critical medical intervention. If you experience symptoms suggestive of a myocardial infarction, the best course of action is to seek immediate professional medical help. So let's clear this up. Chest pain isn't the only symptom of myocardial infarction, and painkillers aren't a cure. It's crucial to remain informed and take action when necessary. Lastly, there are misconceptions about lifestyle after a myocardial infarction. There's this idea floating around that if you've had a heart attack, you should avoid exercise like the plague. However, this couldn't be further from the truth. Once a patient's condition has stabilized, appropriate exercise can actually enhance heart and lung function and help prevent a recurrence. It's all about finding that sweet spot between rest and activity, under the guidance of your healthcare provider, of course. Now let's talk about diet. Another common myth is that patients with myocardial infarction should steer clear of all greasy foods. Well, the key here is balance and moderation. Yes, it's important to limit foods high in unhealthy fats, but that doesn't mean you have to give up on your favorite foods entirely. Opt for low-fat options like fish, soy products, and vegetables. So, a myocardial infarction doesn't mean an end to physical activity or all your favorite foods. In conclusion, myocardial infarction is a serious disease. It's not age-exclusive, presents varying symptoms, and requires immediate professional attention. A balanced lifestyle post-recovery is crucial. Remember, understanding myocardial infarction is the first step to prevention and recovery. Stay healthy and informed.
That's all today's content. Please subscribe to my channel and click the bell icon to get notified of my latest videos. If you like this video, please give it a thumbs up and share it with your friends. Thank you for your support. This will make it easier for YouTube's algorithm to recommend me to more people. Thank you for watching.